Good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much. Good afternoon, everyone. As the City of Philadelphia makes plans for summer events and activities, we are continuously looking for opportunities to reimagine our programming in ways that will entertain and bring our community together while keeping health and safety at the top of our minds. That is why we are thrilled to announce that the City of Philadelphia remains committed to hosting our annual Wawa Welcome America Festival this July 4th in a new and exciting way. Michael Delbane, President and CEO of Welcome America, Inc., is joining us here today via Zoom to share more information about this announcement. And I'll now turn it over to him to give some remarks. Michael, please.
Thank you, Mayor Kenney. It's great to be here with you all today, and thank you for having me. On behalf of the entire team at Wawa Welcome America, we are so grateful to receive this green light from the City of Philadelphia to move forward with delivering a completely reimagined virtual July 4th festival. And while we may not be able to gather in Philadelphia's great public spaces this year, we are excited to give all Philadelphians something to celebrate. This new virtual festival will include so many of the elements that people have come to know and love over the past 28 years. Arts, culture, entertainment, history, education, all back again this year and all available from the safety and comfort of home. In the coming weeks, we're going to unveil a comprehensive week-long lineup of virtual programming for everyone to enjoy. We invite folks to visit welcomeamerica.com and to follow the Wawa Welcome America social media channels to stay informed and to stay updated. In the meantime, we want to take a minute to again thank you, Mayor Kenney and the City of Philadelphia for this green light, to the Board of Directors at Welcome America, to the incredible sponsors who have stepped up to keep this festival going. Wawa, Comcast NBC 10 and Telemundo, Independence Blue Cross, Live Nation, Visit Philadelphia, Pico, and so many more. And we also want to take a moment to thank the talented men and women from various City of Philadelphia agencies who have, for their relentless energy in making sure that this festival continues to move forward. We look forward to having everyone with us from June 28th to July 4th. It's going to be a wonderful, wonderful festival, and we hope everyone will make plans to celebrate with us again this year. Thank you.
Thank you, Michael. Philadelphia is a city of strong traditions, and I'm excited to see this important tradition continue. For the past 28 years, Welcome America has been synonymous with 4th of July in Philadelphia. We understand that one of our community's favorite parts of this great tradition were the performances. That is why we are excited to confirm that we will still be producing a concert in partnership with Live Nation that will be broadcast live on NBC 10 on July 4th for viewers to enjoy from their home. Again, the Welcome America team will be sharing more details in the coming weeks, but we are proud that the City of Philadelphia is able to continue to come together to create memorable experiences for our friends across the city and beyond. And now I ask Dr. Farley for his daily update.
Thank you, Mayor. We are continuing to see progress against the coronavirus epidemic here in Philadelphia. Since this time yesterday, we've confirmed 224 new cases of infection in Philadelphia residents, bringing us to a total of 18,537 since the beginning of the epidemic. Now, we've had a relatively low number of laboratory reports that came in today, and so we would expect that daily number of 200 to go up in the coming days, but it's still low compared to where we've been, and our trend overall is still downward, which is a very good thing. We're also seeing progress on combating the epidemic that is occurring in congregate settings. In particular, we're seeing a decline in the number of cases in nursing home residents. That's particularly important because that's where a majority of our deaths have occurred. I've been talking about that in previous days, but today you can see that for yourself. We're going to be posting on our website today a graph of the number of cases in nursing homes by day, so people can get a sense of where this began, where it peaked, and where we are now. The epidemic hasn't ended in nursing homes, but we're clearly making progress. We're also making progress in the city's jail. We've had 0 new cases reported in inmates since this time yesterday. Currently, there are only 7 inmates that have active infection. The other ones have been removed from isolation. That's the lowest number we've had really since the beginning of this cluster. Since this time yesterday, we've confirmed 15 new deaths from the coronavirus infection, bringing us to a total of 908 deaths. Of those, 482 or 53% were nursing home residents. Every death is tragedy. We don't want to have any death, but the trend in deaths per day is clearly downward in parallel with our success against the epidemic overall. So that's a very good sign. We're also seeing progress in our hospitals. As of this morning, there were 758 inpatients with coronavirus infection in Philadelphia hospitals, and 1,432 in hospitals in the Southeast Pennsylvania region. That reflects a continued decrease. We've been going down about 7 straight days in a row. That's a good sign. Testing continues to be more widely available. Just to remind people that we're now recommending testing for anyone at any age who has symptoms that are compatible with the coronavirus infection. That's really the new onset of a fever and a cough. Anybody with those symptoms can be tested at more than 40 different sites across the city of Philadelphia. Just go to www.phila.gov/COVID, look for the different sites, call ahead to make an appointment. They want you to do that. Then you can go to a number of sites and be tested. Overall, there's a clear sign that we're making progress against this epidemic, but it is still too early for us to be able to say we can reopen. We simply have too many cases, but we can prepare for whatever that day is when we can reopen. As I said yesterday, and I want to just keep repeating this, people need to be getting used to 3 things: wear a mask, keep your distance, and wash your hands. Now, before I finish, I want to just talk for 1 minute about a public health issue that is not directly related to COVID, but is nonetheless important. You know, the number 1 preventable cause of death in infants in Philadelphia is sleep-related deaths. That's an infant who dies suddenly in his sleep. And the greatest risk factor for that is an infant that's put to bed not in a crib, but is set on a sofa or an adult bed. So we don't want any children in the city of Philadelphia, any infants, to be sleeping in anything other than a very safe crib. So to help parents do that, my department, the Department of Public Health, is offering free pack-and-play cribs to new parents so that children can be put to sleep safely. And we're working with Indigo, the bike share people, to deliver those cribs in a way that is contact-free so that everyone can be assured that any crib that arrives is not contaminated with the coronavirus. So any pregnant woman who wants to have a pack-and-play so that her infant can sleep safely after it's born can call this number, 267-432-5844. That's 267-432-5844. We can deliver a pack-and-play to you so your infant can sleep safely. Thanks very much.
Thank you, Dr. Farley. We are now going to turn it over to Armando to give the Spanish translation of our speaker's remarks today. Armando.
Mensaje del alcalde Jim Kenney para el martes 12 de mayo del 2020. Buenas tardes a todos. A medida que la ciudad de Filadelfia planifica eventos y actividades para el verano, continuamente buscamos oportunidades para rediseñar nuestros programas para que entretengan y unan a nuestra comunidad, dándole prioridad a la salud y a la seguridad. Por ello, nos complace anunciar que Filadelfia sigue comprometida a organizar nuestro festival anual Wawa Welcome America este 4 de julio, aunque de una manera diferente a lo acostumbrado. Próximamente escucharán un resumen de esta información de Michael Del Bene, presidente y director financiero de Welcome America, donde hay más detalles de este anuncio. Filadelfia es una ciudad de fuertes tradiciones y me emociona ver cómo esta importante tradición continúa con nosotros. Durante los últimos 28 años, Welcome America ha sido sinónimo del 4 de julio en Filadelfia. Nuestros residentes disfrutan mucho del espectáculo y las presentaciones especiales de artistas de renombre. Nos alegra confirmar que seguiremos produciendo un concierto junto con Live Nation que se transmitirá en vivo por NBC 10 el 4 de julio para que los telespectadores lo disfruten desde su hogar. El equipo de Welcome America compartirá más detalles en las próximas semanas, pero estamos orgullosos de que la ciudad de Filadelfia pueda continuar creando experiencias memorables para nuestros amigos en toda la ciudad y más allá. La información sobre el festival Welcome America resumida de parte de Michael Bennett. El equipo de Wawa Welcome America está muy agradecido de recibir la luz verde de la ciudad para seguir adelante con un festival virtual completamente renovado para celebrar el 4 de julio. Si bien es posible que no podamos reunirnos en espacios públicos este año, estamos entusiasmados de que este festival les brinde a todos los habitantes de Filadelfia algo que celebrar. Este nuevo festival virtual ofrecerá los componentes que los asistentes han conocido durante los últimos 28 años. Arte, cultura, historia, educación y educación cívica que ahora estarán disponibles desde la comodidad y la seguridad de su hogar. En las próximas semanas vamos a presentar una línea completa de programas gratuitos para la familia y les alentamos a todos a que visiten welcomeamerica.com y sigan nuestros canales sociales Wawa Welcome America para recibir actualizaciones. Y esta es la actualización en materia de salud para el día martes 12 de mayo del 2020. Desde ayer se han confirmado 224 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 18.537 nuevos casos en la ciudad. Hay una clara tendencia a la disminución de los casos. Reportamos avances en la evolución de los casos también en los ambientes grupales. Hay una disminución de los casos en los hogares de ancianos. En las cárceles actualmente tenemos 7 casos confirmados, el número más bajo en varias semanas. Hoy, lamentablemente, reportamos 15 muertes por la COVID-19 en la ciudad. Hay un total de 908 personas que han muerto por la COVID-19. 482 o el 53% de estas muertes han sido en hogares de ancianos. Recordamos que este virus no discrimina por raza o por género. Hay 758 personas que han sido hospitalizadas en Filadelfia y 1.432 en la región sureste de Pensilvania. Estas cifras demuestran un claro descenso. Las pruebas siguen disponibles con cita previa. Para más información, como direcciones o números de teléfono de los centros de prueba, por favor revisar el sitio web fila.gov/COVID-19 bajo la pestaña FAQ. Hay 40 centros de prueba en la ciudad de Filadelfia y 60 centros en toda la región. Los datos nos muestran que estamos andando en la dirección correcta. Juntos podemos superar este gran reto. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. Please remember, we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. I'd like to ask all of our speakers today to please join us again with audio and video. And we will begin with Chad Perdelli at 6 ABC.
Hear me?
Chad,
Yeah,
there you go.
The education secretary in Pennsylvania said he expects schools to reopen in the fall. For the mayor, do you anticipate that happening in Philadelphia? And I know it's early, but what sort of discussions are happening in terms of how that may look, like possibly some online, some in school, staggered openings, and also busing of students? Can you talk about some of those discussions and what you guys are kind of looking at?
Our hope is that school comes off as usual without a hitch. We've been working hard over the course of the school closure with the district to get remediate some of the problems in the schools with asbestos and lead. It'll all be determined on what medical advice we get from Dr. Fark and from the state health commissioner as to whether or not school can go back to what we're used to, but probably not, because everything we're used to, we're going to have to get used to something different. So I'm sure there'll be a range of opportunities for people to distance at home, to go to school, a building. I don't have any clue how that's all going to roll out. As we get through more closer to September through the summer, we'll have a clearer picture of what we're able to do or not do. And then Dr. Farley can jump in if he'd like.
I will just add, Mayor, that we have had in-depth conversations with the school district about what they need to do to make sure that staff, teachers, and students are prepared for the fall and are actively supporting their efforts to plan in the event they reopen in September.
But the issue will be driven by the numbers. And that's what we can't give you a tight rein on right now.
Okay, thank you. Also, another question from a colleague of mine. A $352 million shortfall for the month of April, year over year. I was told in terms of revenue that was reported by PICA, they were wondering if the taxes, are you going to raise taxes? How are you going to make up that shortfall in terms of city revenue in April?
We've submitted our budget for review, or revised budget for review. We estimate a $650 million overall problem. $50 million is being suggested to be dealt with increased revenues. some for the school district, and the rest of it has to do and furloughs and layoffs. We're on track unless things get really worse. We should be able to get through with what we have proposed. Brian, if you have anything to add.
No, I think our budget proposal was presented. I think we've been asked a number of questions and have presented a significant amount of information. It includes some small tax increases, but mostly cuts in operating departments.
So I don't know all the details of this question, but in terms of the revenue into the city for the month of April 2020 versus 2019, is it down more than you guys anticipated now that the numbers have come in? Where are you at with that?
I'm not sure. We'd have to get the finance to see, unless Brian, you know the answer, to get the finance to see how far off we were.
I think it's safe to say
target.
Yeah, exactly. What the anticipation is that we're going to continue to see significant issues. They've been working with economists to make sure that we understand what the exact impact is going to be on Philadelphia finances. We can certainly circle back with the budget office and the finance director for more specifics, but we certainly knew that our April numbers, our May numbers will be down, and so will the numbers over the next quarter.
Okay, thank you.
Thank you, Chad. We are now going to go to Sheikh Kirshan with Bangla News.
Good afternoon, everybody. I have a question for Mayor. Mr. Mayor, do you have any halal food bank for fasting, like Ramzan fasting food?
I do not know that answer to that question, but we'll get back to you. I don't believe halal food has been included in, unless I'm wrong, been included in the giveaway that we've been, but I know there are groups out there that are Muslim and are abiding dietary regulations and rules in their handout of food. To get back to you on whether or not the city or any of the city related organizations are.
Sheikh, did you have any other questions?
Okay, because there is a lot of people here. In whole Philadelphia, they have like 60 masajid and a lot of people is there, and like Bangladeshi community people and other Indian community people, they ask me this question. That's why I asked you.
We're going to have to get back to you with more specific answers than the one I'm giving you.
Okay, thank you.
Thank you. We're going to go to Mitch Blocker now with NBC 10.
Good afternoon, Mr. Mayor. I'm curious regarding the budget. How much will a virtual event cost the city in terms of taxes and tourism?
Well, we do spend a lot of money on the regular events, the traditional events, so overtime, police, sanitation, public property. So there are money that we expend to do a concert with 200,000 guests. I'm not sure of the numbers. Michael DeBain is still on, I believe. Mm-hmm. He can give you a little more specifics on what the virtual event will cost. I think the entertainers are still, when we announce them, they still get paid. The band the orchestra will still be paid. So it's other, and then you have, again, Michael, you have all kinds of additional workers.
Yeah, thank you, Mayor. So the overall cost of delivering a virtual festival versus a live festival is substantially less. So the investment made by our sponsors and by our organization to deliver it is going to be less, as the mayor said, than it would be in a traditional year where we have to do all of these events live and in person. We're still in the planning process, so we're still working through a lot of what those final costs are going to be. But the bulwark of Welcome America's budget is really generously invested by the sponsors, many that I enumerated in my remarks, but so many more that step up in so many different ways. So we are so grateful and that we've got so many generous sponsors who've made and continue to make those investments that are going to allow us to cover the expenses associated with this virtual festival. But in the aggregate, it will be substantially less than that needed for a live festival.
And I know that you don't have the logistics fully worked out yet, but I'm curious, depending on where you have the gathering and where these performances happen, how will you keep people from gathering in public spaces in order to see these events?
Yeah. So all of the events throughout the entire festival are all going to be completely virtual, meaning that the only way that you can access them is in your home, either through your computer or through television. The one event that the mayor alluded to, which is the concert that will be broadcast live, that will be from a location in Philadelphia. And, just like any other thing that is happening in the city, we, of course, ask people to really respect social distancing, stay home, stay safe with their families, and not come to the location that this is going to be happening when we announce it. And again, we'll continue to deliver that message that we really, really ask people to stay home and respect the social distancing guidelines that are in place.
And we'll be able to secure the venue. There's no doubt about that. And we won't be providing like outdoor jumbotrons for people to watch it. So, when the event location is announced, I doubt people are going to want to stand outside a noiseless area to look at the wall.
That's right.
That wouldn't
get in.
And Mayor,
that would include any fireworks.
We're going to go out of our way to communicate that the event is not accessible.
Fireworks. I have my idea on fireworks, but they're not ready to. It's not ripe enough to be announced yet. But there will not be an outdoor location for people to gather.
And one last question for you, sir. I'm curious, how do you think that this announcement affects morale in the city?
I'm hoping that it boosts morale a bit. There's nothing worse than taking 200,000 people in July in the middle of a pandemic and putting them together on the Parkway so they can breathe on each other. So we don't want to just cancel it altogether. We want to have some ability for people to be energized to stay inside to watch proceedings, and it'll keep people safer and keep them indoors.
Thank you, sir.
Thanks, Mitch. We're going to go to Laura McChrystal now of the Inquirer.
Hi, a couple follow-up questions about Welcome America. So you said a location will be announced at some time, but people would not be able to stand outside it. Would it be an indoor location, an outdoor location?
Indoor.
Okay, and when do you expect that there might be an announcement on whether or not there will be fireworks this year?
Michael?
So we have a press conference, our annual press conference, where we'll unveil the entire lineup of activities for the festival, as well as answer some of these sort of very compelling questions. And that press conference is scheduled for June the 10th.
So you won't be sharing any more about who might be performing or whether or not there'll be fireworks until then?
We wouldn't be, if it were an outdoor concert under normal circumstances, we wouldn't reveal who's performing that date anyway.
Okay. And a last question I have is about the quarantine hotel sites. How many people are currently at those hotels?
I'll have to get back to you on the number today. Yesterday there was 107. But I'll find out if that number has changed at all today.
Thanks.
Okay, thanks, Laura. We're going to go to Natasha Brown of CBS 3.
Hi, this is for Dr. Farley, just in reference to a recent article that we saw about an outbreak at a men's shelter in Kensington over the weekend. Can you tell us more about that, or what's being done in some of those congregate settings to make sure this doesn't continue to happen?
We heard about cases that were involving a men's shelter. And so we went in and did testing on a fairly large number of people who were living in the congregate part of that shelter, all of whom had no symptoms. And we found a fairly large percentage of them tested positive, even though they had no symptoms. Those that are tested positive have now been offered, and I believe they're all at the Holiday Inn, so that they're not exposing people who were negative. And we were surprised at the number that were positive, and that's causing us to think about what we ought to be doing in other congregate shelters. And not all of our shelters are congregate, but to see what we can do to prevent transmission and what sort of testing strategy makes sense elsewhere.
Okay, thank you.
Thanks, Natasha. We are going to go to Denise Clay of the Philadelphia Sunday Sun.
Yes, I have a question for the gentleman from Welcome America. how normally what drives Welcome America, what makes it a big event that makes a lot of money for the city is the fact that it attracts people from literally everywhere. Is there a plan to market the festival the same way, despite the fact that it's virtual? And also the events that you do have to pay for, like the ice cream social that's on Penn's Landing, or the Taste of Philly. I guess what are those going to be done? As part of this virtual Welcome America, or are those just going to go by the wayside?
So thanks for those questions. To answer your first question, we are absolutely going to market this virtual festival to folks across the city, across the region, across the country, and frankly, around the world. One of the most exciting parts about a virtual festival is that it can be accessible from anywhere in the world, anywhere where you have an internet connection. And of course, then the folks who are in this region can enjoy things on NBC 10. So we are going to work with our great marketing partner, Visit Philadelphia, who's been a great partner of ours over the years, and other social media agencies and things like that, just to make sure that we get the word out that anybody that is interested in having a virtual July 4th experience should tune in to Welcome America and come and celebrate in Philadelphia. While they are in the comfort and safety of their home, they can still enjoy this strong tradition that happens in this city. And so we're really excited actually about the reach that a virtual festival has, far and above anything that a live festival could ever hope for. When you ask about specific events, there are some events that are going to be reimagined and delivered in a virtual festival. Performances, for example, by some of our great partners that people have come to know and love over the years. We're going to reimagine those, and we're going to find a way to deliver those in this new virtual format. There are going to be some events, unfortunately, that have been part of prior Welcome America festivals that will not be able to translate to a virtual experience. So I think you're going to see a lot of things that are tried and true, but you're also going to see some new things that the virtual format that we're going to use is going to enable us to realize.
Now, how much in terms of tourism dollars does Welcome America bring to the city every year? And I guess how are you going to be able to charge for certain things, or is the sponsorship going to be the same because it's virtual rather than in person?
Yeah. So as far as the specific economic impact data of Wawa Welcome America's festivals, it varies from year to year, depending on various different things that affect how many people come. And I would certainly be happy to follow up with you and share some really hard and fast statistics about the more recent festivals that we've had. This year's festival, as with all festivals, will be completely free. So there will be no barrier to, as far as economics are concerned, there will be no barrier to enjoy the virtual festival. You'll be able to access all of our programs on welcomeamerica.com or on the websites of our partners completely free of charge. And all of the programming will, again, of course, be family friendly to really help Philadelphians and people from all over come and enjoy it. So again, the sponsors who have made significant investments in keeping this festival alive have stepped up again. They are committed to making sure that this strong tradition continues in Philadelphia, and it's through their generosity and through their philanthropy that we're able to keep this festival free and family friendly for everyone.
Okay, thank you.
Thank you.
Thanks, Denise. We're going to go to Pat Loeb of KYW.
Hi, Brian. The 107 figure, is that in both hotels?
No, that was just the Holiday Inn, and if I remember, it was less than 10 at the Fairfield. And I think as we have looked at the census at both, and last week we adjusted protocols, expected our census to increase pretty dramatically. Did not increase as quickly as we thought it would. We're still reviewing those protocols and expect to adjust them again to increase the census at those hotels and try to get anyone with a sensitive backgrounds or medical issues out of congregate care settings.
Thank you. And Dr. Farley, when you say you're rethinking what should happen in those congregate settings for the unsheltered, what could you go into a little more detail about what you're considering doing differently?
I think it's too early to say what we're talking about, but really there's two issues. Is to what degree do you test people who don't have symptoms, and to what are there physical controls to prevent spread of infection from one person to another that you can impose in a congregate setting. We'll just have to see as we talk more about it.
Okay, thanks. And then I just wanted to say if Welcome America is going to provide those economic impact numbers, can you send them to everybody, Kelly?
Sure. Yes.
Thanks.
I'd be happy to.
All right. Thanks, Pat. We're going to go to Jack Tomsick with Metro.
Hello. A big part of the July 4th celebrations are the historic sites. Does the city expect that Independence Hall or any of those other historical sites will be open by July 4th?
I don't think we know yet.
Jack, did you have any other questions?
Yes. Sorry, my feed cut off.
Sorry.
Will there be any other? Will there be any in-person events as part of this festival?
Michael?
No, there will not. 100% of the events will be made available virtually, but there will be no opportunity for folks to come together in this year's festival.
All right. Thank you.
Thanks, Jack. We're going to move to our second round of questions now. Joe Brandt with NBC 10.
Hi, can you hear me?
Yep.
Okay, let me see. All right, this question is for Mayor Kenney. Mayor, we have reported multiple times about the Black Doctors Consortium. They're providing tests for underserved communities. I'm wondering if the city is doing anything, working with this group, funding the group, if there's been talks about that. Can you comment on that?
Brian can lay out a little more detail. We are working with them. We've provided them with PPE. We've worked with them relative to nonprofit status, which I don't think they had. And we're working with them relative to reimbursement from medical insurers for the tests themselves. So there's a process for them to follow. And I believe there may be some additional efforts for community testing, but Brian or Dr. Farley could give you a little more detail.
Tom, do you want to start?
Yeah, let me just say we're interested in expanding testing. We've been limited in the past, as you know, with the number of swabs we have and the test throughput. Gradually, that's improving, and so we want to expand testing in a variety of ways. And so as of today, we're posting a request for proposals for organizations that want to be able to provide testing to groups that currently have not been able to access testing to increase that access. Now, that RFP is clear that we don't have funding for this now, but we are hopeful that we're going to get some federal funding for this in the future. And so in anticipation of that federal funding, we're putting out the solicitation so that organization, as well as others, can apply for funding for those things, those costs that would not be reimbursed through billing. All the organizations will need to bill for the testing itself and for the sample collection, but there may be additional costs that they would incur. And if so, then this, we hope, would be a mechanism to support that.
Okay. And so they can apply for that funding, but at this time, are they receiving any dollars from the city?
Not receiving any funding from the city of Philadelphia right now.
Okay. And just one quick follow-up, if I could, for our sister station, Telemundo. They wanted to know about the testing sites for underserved Hispanic communities. I know that they have, I believe there's one in Hunting Park and one in Kensington. How's that going? What is that situation like right now?
There are testing sites in Kensington. There are testing sites in Hunting Park. I don't have data on how many people they're serving, but they're absolutely available. If anybody wants to be tested there, they can go on our website and get the phone numbers, call up, and go in there and be tested. And they're accessible to anybody, regardless of documentation status, regardless of insurance status.
Mm-hmm. And one quick follow-up, the one in Hunting Park is Spanish language, correct? They speak Spanish there?
I believe so, but I'll need to double check and get back to you.
Okay, thank you.
Thanks, Joe. We are going to go to Claudia Vargas now of NBC 10.
Hello. Okay. wanted to check, given the expanded criteria for testing, are you guys allowing inmates, if they're not showing symptoms, if they request to be tested, can they be tested?
At this point, we're not testing inmates that are asymptomatic, but similar to other congregate care facilities, we are reviewing that protocol. And if we make changes, we'll certainly announce them here.
Okay. Is that also the case for, I guess, like recently released, like folks who've maybe been released within like the last 2 weeks or so?
Yes.
Okay. All right. And then for the recently released, do you guys have any policies or plans in place to track whether they did develop symptoms after coming out of the city jails, like, within the 2-week period that usually, I guess, there's a potential for the virus to actually come about?
I'm not sure how we would track those individuals once they're released under a judge's order. Those individuals are free to act on their own as free members of our society. And I'm not sure we could require a check-in in any sort of way. Certainly would be interested in that information should it become available, but it's not something that, I'm not sure how we would track that or track those individuals per se.
Okay. And this question, I think, maybe is more for Dr. Farley, but with the release of like so many inmates, which obviously decreased the population, and it seems like it worked because you guys are down to pretty low numbers. But I'm curious more on the number of people that did leave the jail facilities. What's the health risk for those folks if they were asymptomatic or pre-symptomatic with the potential to spread the virus outside of the city jails?
Well, first, let me just say that the releasing of inmates, I don't think is responsible for the decline in the number of cases we have in the city's jail. There's still over 3,000 inmates in the city's jail, and we had no more than 200 became infected. And so it was the infection control practices that the jail put in place, following CDC recommendations, that appears to have contained this outbreak. And let me also point out that the virus is circulating in the community as much, maybe, or if not more, in certain populations than it was in the city jail. So actually, I'm forgetting specifically your question, but I don't think that the inmates coming out of the jail are any less risk than anybody else in the community, and I don't think that their experience in the jail really changes their risk.
Well, I mean, given that they're in a congregate setting, which, I think you were just talking about, like, for example, in the men's shelter, like when they're close together, there's potential for spread. And so that's where my question is based on, like, given that they're coming out of these facilities where there's greater risk of spread because they're in close quarters, could there be a greater risk for them to spread that outside?
Yeah, well, certainly of the, we have hundreds of cases a day that occur in the city as a whole. And so the number of inmates that are coming out of the jail, even if they were infected, would be very small compared to that pool, so that they wouldn't necessarily pose a risk to others. And although the jail, I don't know all of the sleeping arrangements, but it's not the entire jail. They're all sleeping in one big room. There are many of the individual cells. And so if they're in individual cells separated off, then they don't have the kind of risk that they would in, say, a congregate shelter where we're all sleeping in one big room.
Mm-hmm. And I'm sorry, because I missed this. I think I only caught the second end of it, but with the men's shelter, did you go over any of the numbers, like how many ended up testing positive that were asymptomatic?
I don't have the exact numbers, but we can get them for you.
Okay, great. All right, that's all. Thank you.
Thanks, Claudia. Seeing no further questions, that concludes today's daily briefing, and we will be back at 1 p.m. tomorrow. Thank you.